Across the country, healthcare poses a huge challenge. While the cost balloons, the health of Americans is suffering.
Care is very fragmented. Patients see one doctor, another hospital. They bounce all over the place, and there's nobody serving as the captain of the ship.
And when you get into patients who are living with multiple chronic diseases, it becomes quite complicated for them and their families to manage.
The concept of the patient-centered medical home provides a solution, a new method of delivering health care with 3 goals.
Improving health of our population, improving quality of care, and reducing the cost of care for American people.
When it comes to overhauling their systems, large and small medical practices each have unique weaknesses and strengths.
Most of the outpatient visits in the country are provided in these small independent practices. And they have some terrific advantages when it comes to changing how they deliver care.
For one, they can implement change quickly. With a small, close staff, one person passionate about reform can easily inspire others. Take Deborah Bowen, the billing manager at Jordan Meadows Medical Clinic in Utah.
Initially, she kind of was dragging the cart, and everybody was on the cart instead of, and as we got more involved, you know, everybody got on board, and then it was just moving the cart, but everybody's helping push.
Since they deal with less red tape, smaller clinics will often experiment with creative new ideas. Plus, they already excel at giving patients personal attention.
The receptionists know who the patient is, the MAs know who the patient is. I, as in the billing office, knows who the patients are if I've had to work with them. And so you get to build that relationship.
On the flip side, small practices often lack funds and need more resources.
The EMR that we have been using for all these years works well for us to see patients, but we just are not able to do any sort of population management with it, and we really need to be able to do that.
A lot of care coordination is going to take a lot more staff, and so how do you fund that? How do you keep that going while still seeing patients?
Plus, those passionate leaders who spearheaded change can sometimes burn out or leave the clinic, and other times their efforts are too specific to their own practice.
If we have a dozen different small practices, each on their own electronic medical record, each working to improve a different part of care, the result for the community may not be as strong as it would have been had they all focused together on the same agenda or had the same information systems.
Large practices, meanwhile, have a depth of resources that cater to patients. At the University of Utah's South Jordan Health Center, patients don't just see their primary care provider. They can also find a pharmacy, radiology services, and physical therapy center. Larger practices have more staff to cover extra duties. Even workers dedicated to transforming healthcare, like the University of Utah Healthcare's Transition Navigator.
She makes sure that if there are appointments that need to be followed up on after the patient leaves the hospital, that those appointments are made and followed through on.
But in a large practice, everyone tends to have a different way of doing things.
You have so many more people putting information and data into a system that it complicates getting clean, lovely data out of the system.
Changes must go through layers of approval, and institutions that succeeded the old way may not want to try new methods.
Changing such a large organization is like getting a battleship started moving away from the dock. It has a lot of inertia to continue being where it is, continue doing things the way it has done things in the past. There are a lot of people involved that need to change their behaviors.
Though difficult to start, once the battleship gets going, it moves in one unified direction and is almost unstoppable. Meanwhile, the small practices could be compared to personal watercraft. They are small, agile, easy to get going quickly, and can speed off in many directions.
It's kind of like we have a whole fleet of these Waverunners that are all zipping around in different directions. But how do we get them going in the same direction? And how do we make sure they don't run out of gas and just stop? That's the challenge with the small practices.
So the big question is, how do you find a balance between the personal watercraft and the battleship? The reality is, one is not better than the other.
It's probably going to be figuring out how to take advantage of the strengths of both. In a way, we may need to think of creating a fleet.
Side by side, large and small organizations can learn from each other and tap into the other's strengths.
We need to learn and benefit from what they accomplish and help together to change how we take care of people in the United States with an effective healthcare system that controls costs and improves the overall quality.
The task is not easy, but it carries a great reward.
You know, I'm excited. I think that ultimately it's going to be for the good of the patient. You know, an ounce of prevention is worth a pound of cure. And so we can hopefully make some impact.
And we've helped patients. They've gotten their diabetes better under control. They're healthier. They've got a better quality of life. And they're going to be able to be around for their families.